Looking after your feet is an important part of your daily routine. Wash your feet with soap every day. Use water and soap to wash your feet and legs. Use a cloth to wash between all the toes. Give the soles of your feet some special attention too. Dry the feet off with a clean towel. Dry well between the toes. Take a close look at your feet. Look and feel with your fingers to see them. If you can't reach your feet or you can't see your feet clearly, have somebody do it for you. Or try to use a mirror to see under your foot. It is really important that your feet are cared for every day. If you see thick, hard skin, it is important to care for this. This is often called a callus or a corn. Thick, hard skin can cause damage and pain to the skin. You need to have a pumice stone or a green pot scourer or fine sandpaper to help reduce the thick skin. Let's call this a sanding block. Place the foot back into the warm water. Put some soap over the dry, thick skin. Reach down and carefully work the thick skin with the sanding block. Check and be sure that the normal skin is not damaged by the grit of the sanding block. The sanding block should only contact the hard, thick skin. Repeat each time, reapplying the soap. Use the sanding block and then check. Look and feel the skin to know when the thick skin has been reduced. Have a health worker make an appointment with a podiatrist to have it checked out. If you see dry skin or thick, hard skin, you need to rub in some cream. Any cream you buy from the store as a hand cream is suitable for your feet. It is good to use the cream after rubbing the thick, hard skin with the sanding block. It is good to use cream every day for dry skin. If you see sores or that the skin has been injured, it is important to help it heal. Any blister, cut or red crack in the skin or where pus is present must be looked after. Wash with some salty clean water. Use a clean cloth or gauze pad or cotton wool ball to wipe the salty water over the area of the sore. Repeat this a couple of times. Dry the skin off. Apply a band-aid or dressing from the health clinic. To make salty water, boil the kettle and let the water cool. Pour the water into a clean container, add a teaspoon of cooking salt, screw the lid on, shake the bottle to dissolve the salt. Throw the salty water out if it becomes cloudy or discoloured. Check on the sore each day. Wash it with salty water each day and cover each day until healed. Visit the health clinic or see a health worker if the sore is not improving. If you are at all concerned about a sore, see the clinic. Ask the health clinic if they could provide you with some first aid products to keep at home, just in case you need to care for these small sores. How to look after your toenails. The length of your toenail should be as long as the tip of your toe. If your nails are too long, they can cause pressure and cut into the toe or the next toe. If your nails are too short, they can hurt the sides of the toe and cut this area and cause infections. Trim the nails straight across, or so the length of the nail follows the curved shape of the toe. Don't cut the corners down into the sides of the toe. If you can't reach or see your nails, ask a member of your mob or friend. If your nails are too hard to safely care for, see the health worker to arrange an appointment to see a podiatrist. Your feet need protection to make sure they don't get cut and damaged from things we might walk on. Remember, if you don't have good feelings in your feet and they are numb, injury can occur without you knowing. Wear some form of footwear at all times. It is really important to wear shoes that fit. If not, the shoe can cause sores and make your feet worse. Wear clean socks to give added protection to your skin. With closed shoes, empty the contents of the shoe before putting them on. Check the linings of the shoe. Put your hand inside the shoe and feel for torn linings. Check the insole material is in good condition. Whenever you are wearing new shoes, check your feet after 1 hour of wearing them. Look at your feet and check that they are not damaging your feet. Don't wear shoes that damage and hurt your feet. Diabetic foot problems can happen if your diabetes control is not as good as it could be. The longer you have had diabetes, the more important it is to look after your feet. At least once a year, everyone with diabetes should have a foot examination. See a health worker to make arrangements for you. It is very important for you to take the tablets that the doctor gives you for your diabetes. Make sure you never run out of tablets. Attend the health clinic to have your blood sugar monitored regularly. People with diabetes need to eat well and to have healthy foods. See the health worker for some advice about what foods are the best for your health. The health worker may be able to make an appointment with a nutritionist who could provide additional information about healthy foods. Keep active every day. Walk to the store. Enjoy getting out. Go visit some friends. By walking and keeping active, it improves your blood flow to your feet and helps control your diabetes. Get a pair of well-fitting joggers and enjoy a daily walk. Care for your feet and they will keep you going.
This material is part of the series developed in 2005 by Sarah, Services for Australian Rural and Remote Allied Health. Additional explanation notes are available. Go to Main Menu, Segment 5, Resources, or visit the Sarah website.